Here now to talk more about how exactly smoking marijuana can affect you is Albert Ofori, nurse practitioner with American Addiction Center. So Albert, you work with people struggling with addiction every day. What are the dangers of smoking marijuana? You know, most people don't think you can get addicted. What do you say to that?
Well, any substance that alters the mind or impacts the functionality of the prefrontal cortex, such as marijuana, should not be viewed as being generally safe in any regard. Though marijuana is widely believed to be a non-harmful substance, there are evidence to the contrary. One study has shown that dependence on marijuana occurs sooner than the development of dependence on nicotine or alcohol. Additionally, according to the latest figures in 2019, a marijuana use disorder existed in 2.8% of people ages 12 to 17, 5.8% of those aged 17 to 25, and 1% of those aged 26 and above.
You know, those percentages seem so small, but you don't want to hear that at all. You know, we spoke with the author of a recent study by the National Institute on Drug Abuse, who says young people are more likely to develop substance use disorders after first trying cannabis. Talk about why that is and if parents should be concerned.
Well, many factors play into the development of addiction, including environment and genetics. Often people with addiction struggle with maintaining dopamine levels. And the introduction of a chemical or a drug that spikes up the dopamine makes them feel amazing. That chemical or drug can be alcohol or marijuana. When the dopamine is stimulated, the brain's reward centers are activated, which is why the drug of choice is pleasurable. In the case of marijuana, I believe that many people develop the dependence on the drug, which then turns into marijuana use disorder. In 2015, nearly 4 million people met the diagnostic criteria for marijuana use disorder. So addiction to the substance is possible. It will serve well to conduct more research in this area of addiction, as well as addiction as a whole.
Some argue that marijuana is a gateway drug. Do you believe that?
Yeah, I definitely believe that. So using marijuana, like I said, is very addictive. So if people start using marijuana at a tender age, they tend to try to use other substances as well.
What has your experience been like in helping people overcome addiction?
Well, I've dealt with patients who are addicted to several drugs like marijuana, opiates, and methamphetamine. And it turns out that they'll have several other addiction issues apart from all of these ones. So it's very important to educate people on substance use disorder.
All right, Albert Ofori, nurse practitioner with American Addiction Centers. Thanks for being with us today.
All right, thank you.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and click on the bell to get updates to all of our newest content, because we are putting your faith in the news.